Good evening. It gives me great pleasure to welcome you to the International Saving Lives Campaign webinar, a dialogue of Cuba's heroic response to the COVID-19 pandemic. My name is Sean O'Donoghue, and I'm the secretary of the Table de Concertation de Solidarité Québec-Cuba, which is an equivalent of the Quebec National Network on Cuba, equivalent to the CNC, Canadian Network on Cuba, and the National Network on Cuba from the United States. I'd like to welcome our distinguished speakers, Dr. Agustin Lage. These speakers are doctors and scientists, very well-knowledge people. We're going to have a good information from them. Dr. Samira Addrey and Professor Pedro Mas Bermejo. They will be introduced by our two panelists, our two moderators, excuse me, Dr. Lenny Villagomez-Reeves and Alison Bodine. I give a special welcome to the public who is connected to learn more about Cuba and its efforts against the COVID-19 pandemic at home and abroad. We know that Cuba sent, during the pandemic, sent to about 40 countries, close to 2,000, I think it is, 2,000 professionals. So there's a lot to talk about. Actually, it's more like 4,000 professionals that were sent abroad in the past couple of years. As you know, we participated in the campaign so that Cuban medical brigades could get the Cuban Peace Prize, the National Nobel Peace Prize. There were 200 candidates for this Peace Prize, and Cuba did not get it. However, in the United States, they were given the People's Peace Award, which we feel is very well deserved. I would like also to give a special thank you to the Cuban General Counsel for Eastern Canada, who is listening in, Mara Bilbao Diaz. Her family and her team have been held over here in Montreal for more than 2 years beyond their normal stay because of the pandemic. I'll just say a couple of words to our friends from Québec. Bonjour à tous, bienvenue. Vous savez que c'est un honneur pour moi de représenter la table avec le réseau canadien et le réseau des États-Unis. Je vous souhaite une bonne soirée, une bonne conférence virtuelle. Have a good evening, everybody, and have a great conference. Thank you.
Thank you very much to Sean O'Donoghue with la Table et Concertation de Solidarité Québec-Cuba. It was an honor to have you here today as part of the Saving Lives webinar, a dialogue about Cuba's leading struggle against the COVID-19 pandemic, and really to participate together in building consistently and strongly in support of Cuba at this difficult time of the global pandemic. Being able to work together between Quebec, Canada, and the United States has been a great advance for Cuba solidarity over the past year and a half. Thank you as well to everyone joining us here today. My name is Alison Bodine. I am a social justice activist, writer, and researcher here in Vancouver, Canada. Today, I'm calling in from the unceded territories of the Coast Salish people, the Squamish, the Tsleil-Waututh, and the Musqueam nations. I have been working in solidarity with Venezuela and Cuba for over 15 years. I've traveled to Cuba, been fortunate enough to do so over a dozen times since 2006. I am the coordinator of the Fire This Time Movement for Social Justice Venezuela Solidarity Campaign and on the editorial board of the Fire This Time newspaper. I'm also author of the book Revolution and Counter-Revolution in Venezuela from Battle of Ideas Press. Today, just before this meeting, I went on to Reuters, and they have a webpage about how fast countries are vaccinating around the world. A very important quote was on the website today, saying among countries with more than 1 million people, Cuba is currently vaccinating faster than any other, administrating a daily average of 1,988 doses per 100,000 people in the past 7 days. Cuba is third in the world, in fact, for most first doses at 85% of the population, while the United States is at 66% and Canada is at 78%, where they have basically plateaued. Cuba's outstanding leadership in the worldwide struggle against COVID-19 is what we are here today to discuss. Together with a very distinguished panel, as Sean mentioned earlier, we will begin to answer the question of how a country that has been under a suffocating and cruel blockade has made such tremendous gains in fighting this global pandemic. Before the 2020 elections, President Biden promised to end the Trump-era tightening of the criminal US blockade on Cuba. Instead, he's continuing to tighten restrictions against Cuba amidst the global COVID-19 pandemic, demonstrating once again the cruel nature of this over 60-year-old US policy against Cuba. On September 7th of this year, President Biden extended the United States Trading with the Enemy Act of 1917, which is one of those so-called legal basis for the blockade against Cuba, which imposes trade restrictions and economic sanctions against Cuba and has been renewed annually by the US president since the 1960s. The new Biden administration has not removed Cuba from the so-called list of state sponsors of terrorism, nor reversed any of the anti-Cuban measures implemented by the Trump administration over the last 4 years. For people looking towards and fighting for a better world, Cuba has long been a beacon of hope. In today's uncertain times, while a global pandemic is being mishandled by the governments of the US, Canada, and other capitalist countries, Cuba stands as an example and a leader. For many years, Cuba has built a world-renowned healthcare system that puts people's health and well-being over profits. And we're going to explore that here today. I'll say briefly that we are having a direct connection with Cuba, which we're really honored and excited about. We have an outstanding and distinguished professor and doctor, Dr. Mas Bermejo, who's here. But if you hear some background noise or he drops unexpectedly, it's because of the difficulties with connecting on Zoom with Cuba due to the US blockade. But we will have patience and we'll deal with it with grace, I know from all of us here today. So I'm going to ask people to help us participate in this conversation to go ahead and start putting your questions in the Q&A box in the center. We have some questions already, and we're going to give our speakers a brief time to open, but we are ready to take your questions and incorporate them into our conversation today. Please also make sure to look in the chat for links with more information about how to get involved and how to donate to a project that we're supporting here today called Proyecto El Pan, which is delivering food to Cuba and is based in the Cuban American community here in the United States. Now I want to introduce my co-host today, who I've known for a while, probably since nearly my first trip to Cuba, which is Dr. Lenny Villagomez-Reeves, who's a former United Farm Workers volunteer who attended UC Berkeley and the University of California, San Francisco. She worked at the Valley Children's Hospital for many years, doing pediatric emergency medicine. Dr. Villagomez-Reeves is active in the Women's International League for Peace and Freedom, where she co-chairs its National Cuba and Bolivarian Alliance Committee, and with the Pastors for Peace Friendshipment Caravan to Cuba and the Saving Lives campaign. Welcome, Lenny. You are on mute.
Hi again. As Allison said, I'm Dr. Lenny Villagomez-Reeves. I'm a pediatric emergency physician. I'm speaking to you from the mountains of Central California, unceded Mono, Nim, and Yokuts territory. When there's no pandemic, I spend about 2.5 months of each year in Cuba, where I have close ties. Cuba is unique in the world. Its uniqueness is multiple. It's a place where safety and education and health and opportunity don't depend on money where every pregnant woman has the best prenatal care. Cuba tries to put the compromiso social, the social commitment or commitment to the people, first. They guarantee the right to health and care and education. All the children go to school clothed, fed, immunized, and with shoes on their feet. There are no working children in Cuba. Let's talk about the healthcare system. In Cuba, healthcare is a human right. Access doesn't depend on money. Survival rates for cancer don't depend on income and insurance, as they do in the US. You can look that up. But Cuba spends in a non-pandemic year only be somewhere between 7 and 10% of its gross domestic product on healthcare. So this is not just about more doctors or more money spent. This is a system that recognizes healthcare as a right and organizes to make it real. The Cuban system is universal. It guarantees access. They take a preventive approach. And Cuba, this is important, is illiteracy free. So people can understand what's going on. Prevention is better in every way, humanly and also economically. And Cuba's success demonstrates that universal access and universal health coverage are feasible and indeed are key to success in improving people's health. People go to Cuba and they forget to wonder why there are no tropical diseases there. It turns out there are no tropical diseases. There are only diseases of poverty. The free, universally accessible, community-based healthcare system has transformed the country. Another area of uniqueness. Cuba is the only small country, the only third world country, and the only Latin American country to develop any vaccine. The Cuban people have decided to continue their medical solidarity, already strongly expressed in medical brigades in the Latin American School of Medicine, with extending access to the Cuban vaccines to countries that can't afford the vaccines developed by the world's great powers. Cuba can do this because Cuba has a robust, innovative, advanced biotechnology sector. Despite 6 decades of US blockade, they've come up with absolutely amazing novel drugs and vaccines before. Cuba's biotech sector is unique. The national health system is its first priority, an orientation toward global South-South cooperation. And this biopharma sector is entirely owned and financed by the Cuban people, which is the Cuban state, not by speculative capital, and developed by planning, not market forces. It responds to the needs of the Cuban people and not to profit motives, and has a closed cycle strategy of all processes from basic research to production to post-use follow-up. And it's based on collaboration, not competition. And this model has worked. Cuba is also very unique in international health, and its unique position is based on solidarity. Cuba's solidarity means, in the famous quote, the Cubans share what they have, not what they have left over. And Cuba's medical solidarity didn't just begin during the pandemic. In 2005, the international contingent of doctors specialized in disaster situations and serious epidemics, Henry Reeve, was created, made up of medical specialists from many branches of medicine who enlisted on a voluntary basis at that time to go to the United States and help during Katrina. Obviously, Bush turned them down. In these 15 years since, over 13,000 Cuban collaborators have cared for well over 4 million patients in 53 countries. During the present pandemic, the Henry Reeve contingent has so far sent 53 brigades to 39 countries and territories at the request of their governments. More than 4,000 Cuban health professionals, 61% of whom are women, are participating in this unprecedented effort. At the same time the Henry Reeves Brigade was facing the pandemic in the world, the Trump government was tightening the blockade of Cuba to inhumane limits and unleashing a ferocious campaign of slander and malicious representations and lies against Cuban medical cooperation, and even going to the extreme of pressuring and threatening the governments of countries requesting the aid from Cuba. In addition, as we all know, Trump put in place over 240 new blockade measures, some of them actually during the blockade period, and deliberate targeted efforts were made to cut off fuel and medical supplies, even donations of PPE, even ventilators from Cuba, as well as cutting off sources of financing, even for medical research. One last evil action was to place Cuba on the list of state sponsors of terrorism. And as you all know, when Biden took office, we expected a change in Cuban policy. And as his campaign promises included a change in Cuban policy, and almost a year later, nothing has been done. The Saving Lives campaign in the US and Canada offers solidarity to Cuba. We call for allowing US, Canada, Cuba medical, clinical, and scientific collaboration, including inviting Cuban medical brigades to provide direct medical assistance or to provide advice and guidance in treating COVID-19. And most important, we call for ending the US economic blockade and the travel sanctions against Cuba, including its extraterritorial nature and the attempts to stop other countries from accepting Cuban medical brigades and assistance, and all the ongoing measures that prevent Cuba from accessing an important medical equipment and supplies to make medications and medications themselves with which to confront COVID-19. Now we're going to hear from a Cuban physician who is a key leader in Cuba's fight against COVID, Dr. Pedro Mas Bermejo, leader of Cuba's COVID-19 National Technical Group and the National Director of Epidemiology in the Department of Public Health. He holds many other posts and has many publications and honors. We can't list them all here. We'll put them in the chat. Dr. Bermejo, can you inform us about the current situation in Cuba as vaccination proceeds at the highest rate in the world and the numbers of new infections begin to really decrease markedly? Lo que pedimos es que nos informe sobre la situación actual en Cuba, si es posible.
So this is where our patients begin, knowing that we're connecting with Dr. Mas Bermejo in Cuba. Thank you, Lenny, very much for that excellent introduction. We will give him a second, I think, to figure things out, and we'll go and introduce Dr. Samira Addrey, who we also have a question for. Like I said, we're going to have to be a little bit flexible with international.
Can you hear me?
Oh,
Yes.
yes. Can you hear us?
Dr. Mas Bermejo, could you bring us up to date about what's going on now in Cuba in terms of the fight against COVID, with vaccination and with
I have your presentation, Dr. Mas Bermejo. I will put it up and we'll see if we can hear you. I'm going to turn your video off because it will make your audio connection stronger.
While we're
Can you
being
hear me now?
While we're being patient, I would like to answer just one question I see in the chat. Cuba is vaccinating everyone age 2 and over, everyone. So when you look at vaccination rates, that includes children age 2 and over.
No, está grabando la sesión. ¿Dónde?
We can hear you, Dr. Mas. We can hear you. And I have your presentation on the screen if you can see it. I think maybe Dr. Mas cannot hear us. So I'll introduce Dr. Samira Addrey, and then we'll try again in a minute. So we are also honored to have with us here a graduate of the Latin American School of Medicine, who has an incredible amount of experience in living and working in Cuba, and also a keen sense, I think, of contrast between the Cuban healthcare and the US healthcare.
Can you hear me now?
Yes.
We can hear you now. Can you hear?
Alison?
Can you hear me? Dr. Mas, can you hear me? Okay. So we'll go back to Dr. Samira Addrey, and I will try talking again with Dr. Mas. So Dr. Samira Addrey is a 2020 graduate of the Latin American School of Medicine, known as ELAM, in Cuba. She was born and raised in Accra, Ghana, before migrating to the United States at the age of 9 with her family. She is currently the coordinator of the ELAM program for IFCO Pastors for Peace. Dr. Samira Addrey, why do you think Cuba has been so well equipped to fight COVID-19 on the island?
Thank you so much for the intro, Comrade Allison. A pleasure to be here tonight with you all, esteemed panelists and all the participants and attendees who are on this call with us. So many part of the Solidarity movement. The love for Cuba is overwhelming, and it's an honor to be with you all tonight. So thank you to the organizers, the Canadian Network, and as well as the Saving Lives campaign. This is super important. It's an honor to be here. I would like to say that the first point as to why Cuba is well equipped to fight COVID-19 is precisely what Allison and Dr. Lenny both stated earlier, that healthcare or health in general is a human right in Cuba. And because it's a human right and it's treated with such priority within that system, especially since the triumph of the Cuban Revolution in 1959, it has laid the groundwork for how that society as a whole tackles health issues. And the concept of health in Cuba has never been an absence of disease or just curing disease when it comes on. It has been a concept that is embedded deeply in respecting what we learn in public health as the social determinants of health, which are everything from housing, the environment, being healthy, the food you eat, the nutrition, your right to education, quality education, and so much more, safe transportation, different elements of everyday life that contribute to healthy individuals, families, and communities. So that is a framework which Cuba has been working with for quite some time. And while internationally, there were agreements made early on in the history, especially in the history of the UN, about what health was, and with the coming of the World Health Organization about what health was, one of the few countries that actually paid attention and took that message to heart and followed through with the mission of fulfilling the objectives of ensuring health for its population was Cuba. It was very intentional from the beginning of the socialist revolution to fill in the voids that had come to be because at the beginning, when the revolution triumphed, a huge chunk, at least 44% of the medical force fled the country, mostly going to the United States. This left a deficit in Cuba. But what was more pressing was the fact that there had always been huge disparities in health delivery on the island. Rural areas didn't have care. There were places in Cuba where people had never seen doctors before. And so with the revolutionary government making it a priority to grant access to healthcare to everybody in every part of the country was the very first step to creating solutions. In an island where geographically is in the midst of an area that is plagued by not only natural disasters such as hurricanes, but also being a tropical island has a vulnerability to tropical diseases. And these are things that would suck the life out of the population of the Cuban people. But with the health infrastructure being laid to be focused on primary health care, this made tremendous advances. And Cuba has such a beautiful history when it comes to medicine and health. Even before the revolution, we see the important role that, for example, Dr. Carlos Jotafinle played in identifying the mosquito that would transmit yellow fever, and how his discovery and the understanding of the medical community, although initially they didn't believe him, after about 9 years, they took him seriously and used that to implement a process of eradicating mosquitoes that would carry yellow fever and diminish the population and affect Cubans. And this was very, very essential in laying the foundation for the importance of microbiology and tropical diseases, and how Cuban physicians took that seriously. So that already laid a foundation for respecting science, right, before the revolution. And so after the revolution, this continued. This respect continued, the dialogue, and the fact that Cuban doctors were now being sent to areas, rural areas, different areas than they were used to, because that was what was required, also sensitized the medical force to see the need and not be caught up in, a bubble of being in urban cities where there were saturation of health centers, and thinking that everybody had this access, which was a wrong idea. So it taught values that were essential about how to combat and how to understand the relationship between man and his environment, the relationship between man, and how we should help each other overcome certain phenomenons that unfortunately are natural, but we can work to tackle. So when COVID hit, after years of the revolution working to shape the health infrastructure of Cuba, laying the foundation for the polyclinic in every community to be a centerpiece. Then later on in the 80s, making the family doctor and nurse program a cornerstone of that health system. It made each year, the healthcare delivery became more of an activity that was something that what people participated in at every level. And one crucial aspect of this whole history of Cuba has been involving the masses in every aspect of designing healthcare. Having the comités de defensa de la revolución, the CDRs involved, having the Federation of Cuban Women involved in everything from one of the earliest vaccination campaigns was the polio vaccination campaign, right? And the polio vaccination campaign was carried out in 11 days at one point, 11 days. I can't remember the year, but by 1970, that same campaign was carried out in 1 day for the whole country. That was how early Cuba had mastered the importance of mass vaccination and incorporating everyday people in the process, because these mass organizations that I just named, the Federation of Cuban Women or the CDRs, they're all made up of everyday working people who were in communication with their leadership. There was how do I say this? I want to say it in Spanish. Feedback that was going back and forth between the people and the government. So there is no disconnect between that. Often we hear of people trying to separate the Cuban people from the Cuban government. No, it is one, because the Cuban people make up the Cuban government at different levels. And they carry out these national plans, because you can't just have theory and you can't just have professionals make up a structure without the full involvement and participation of the masses. And that's what happened in Cuba. So when COVID-19 hit, with that kind of infrastructure already in place for decades, we had a situation where immediately the masses were being educated on the preventative measures that were required to first create a barrier between the microbe that would infect people and cause the disease. So the standard measures of social distancing, masking, washing your hands, everything, it was almost overnight. When I was there, that was my final year. I saw within a week, I saw people putting out their basins, their hand washing basins, and their rags for you to clean your feet before you enter the premises, and enforcing that, because I was living on a student campus of a huge population, and overnight we saw that people were taking these measures seriously. And every day our scientists and our doctors were on national TV educating the population about what COVID-19 was, explaining all the steps that the country was ready to take, and all the progress that had already started way before the first cases appeared in Cuba. And this was a thinking group of leaders, not only in the scientific field, but every sector. It was a multidisciplinary approach to problem solving. And I think, it was an honor and a blessing to be there in that moment and to see that live engagement of leadership in all spheres, and the importance of having a government that is respectful of the efforts of its scientists and its medical workers, and echoing the same messaging that scientists would give to the people. There was one voice throughout that time in terms of the messaging, and I think that was key in having everybody understand what was important to do and not to do. And I mean, Cuba was well equipped because of so many reasons. The primary healthcare aspect is one of the core parts, understanding how active screening of symptoms was an early practice that laid the groundwork for how people could gauge how this disease was spreading, who was keeping up with measures, who wasn't, who was a vulnerable patient. That information only comes from the fact that you have family nurses and doctors on every block who have accumulated information about their patients every single year. You can only know who's vulnerable in your community if you've engaged with them, you've seen them, and you've talked to them, you've touched them, you've diagnosed them for whatever issues that they have. And this is the core of information that would lead people to target, specific areas and specific populations and protect them first. For example, one of the very first measures that was taken, aside from the active screening, was also to distribute Prevengovir, which was a natural homeopathic remedy to protect the population against cold respiratory infections. This was amazing. This is going on family by family, starting with the vulnerable populations, while scientists are improving on the vaccines and making sure that these vaccines are viable for every sector of the population, especially children. This concept of developing a vaccine that would target children, they started a long time ago, because they knew, as a population that is heavily aging, that they needed to preserve every member of their society. 11.2 million people, they don't have the luxury of letting almost 1 million people die off like we've seen in the United States, as if that should even be a concept that we should be comfortable with. It's appalling, but that is the difference between a Cuban perspective and an appreciation for life. It's deep. It's really deep. So I think I could go on and on about how Cuba was equipped, but hopefully Dr. Mas Bermejo can connect now and also share his amazing work, because the committee that continues to lead the task of guiding the country about how to battle COVID-19 is an amazing group of people from all sectors, and hats off to them for sure, because it's an example we all need to learn from.
Dr. Lenny, you're on mute again.
Yes. Dr. Addrey, can you tell us, this was a question that was in the chat. Is it possible for a person from another country, let's say a Canadian, to go to Cuba and get Cuban vaccine? Because not everybody trusts US big pharma.
Yes, enlightening news that just came out about a couple of days ago. Cuban authorities announced that if a tourist comes and wants to have a vaccine, they can have one. So yes, I do want to mention though that the scheme for vaccination in Cuba is a bit different from what we're used to stateside. So far, the vaccines there are, Abdallah is 14 days apart between doses, and Soberana 02 is 28 days apart. So we'll see. There may be adjustments made. I don't know in the case of tourists or outsiders, but people should keep that in mind, that it would take a longer stay for you to be able to complete the full dose scheme.
Right, and those are 3-dose vaccines. So
3-dose vaccines.
Day 0, day 14, and day 28. Yeah, so it takes a whole month. Spending a month in Cuba right now might not be as much fun as it would have been 2 years ago, but I think it would still be a very rewarding experience.
No, actually, it is going back to fun. They've opened up again quite a bit. You know, the beaches are open, people are back on the Malecon. So, you know, that's the life. People have been locked up for some time, but this is a good time, a new normal, and it's exciting.
I am so glad you mentioned the polio vaccine campaign. Very few people in the world know that Cuba was the first country in the world to eliminate polio. You know, Dr. Sabin published his paper in 1960. He said, we can use this vaccine to eliminate polio. And in all the world, Cuba was the only country that took him up on it. So in 62, they immunized 80% of all the children in two-week periods. You know, and in 1963, they had a single case of polio in the island. In 1964 and afterwards, there were no cases of polio in Cuba. That's those same years, there were many cases in the US, I think over 500. And it wasn't until 1979, 15 years later, that the US actually eliminated wild transmission of polio. That the last case of wild transmission of polio happened in the US. Cuba is so far ahead of the rest of the world in terms of control of infection. And I was going to ask Dr. Masbermejo if he could update us, but I am not sure whether he is able to hear us. Can you update us on the current vaccine campaign, Dr. Masbermejo, if you can hear me?
I think we're still working on getting the connection. We have some experimental ideas we're going to try in a minute, but there's been a few kind of comments or questions talking about vaccine hesitancy in the chat, people wondering about that in Cuba, kind of how they've achieved this high vaccination rate. And I know, Dr. Lenny, you have an anecdote you wanted to share about that. And then we have a really excellent video. We have another excellent video from Dr. Agustin Lage that we wanted to show as well. So let's go ahead and do that, and we'll try our audio experiment with Dr. Mas. So if you want to tell your anecdote and then introduce the video, we'll go into that section.
Yes, I would like to. So, yeah, as you say, vaccine hesitancy was a thing here in the US long before COVID. And years ago, well before the pandemic, I toured the pediatric hospital in Mariana with Dr. Lupe Guevara, no relation to Che, a pediatrician though, and a specialist in traditional and alternative medicine. So I figured she would know about vaccine hesitancy if anyone would, and I asked her about it. And she looked at me really puzzled and she said, well, naturally parents want what's best for their children. Like, why would any parent want to refuse immunizations, you know? And indeed, parents do want what's best for their children. And what is best is a lot more obvious when it's not confused by the profit motives of big pharma and a healthcare industry rather than a healthcare system. It's also a lot clearer when the media promotes popular education rather than ignorance and anti-science. Cuba has a literate population that has had no reason to be afraid, a reliable primary care health system, which is universally accessible, which is free of charge, which has achieved childhood vaccination rates of over 99%. And all Cubans are protected against 13 diseases, and 8 of those vaccines are made in Cuba. So there's a long history of vaccine production and vaccine safety. And they were always thinking about vaccines for children, just as Dr. Addrey said, you know, they've been producing vaccines for children for a long time. And the Cuban anti-COVID vaccines are not mRNA vaccines, they're subunit vaccines built on the same platforms as the pre-existing vaccines, conjugating the spike protein of the SARS-CoV-2 virus with inactivated tetanus toxin. Well, we've all had tetanus shots, nothing bad happened to us. And that's in the case of Soberana 02. While Abdallah builds on the same platform as Cuba's hepatitis B vaccines, which have been in use now for over 25 years. And when Cuban scientists designed these vaccines, they were already thinking about protecting children. Can I run one more personal anecdote by you? We're really fortunate to have a recorded talk from Dr. Agustin Lage. He's one of those directly responsible for the fact that Cuba is on the cutting edge of biotechnology. I have to say, I think I find biotechnology fascinating because it has a human face for me. Not only did I used to see children with devastating, sometimes lethal illnesses like meningitis, which are now vaccine proof. But one of my med school classmates incurred an accidental needle stick and later died of hepatitis B, which is also now a vaccine preventable disease. So when you watch Dr. Lage's somewhat technical video, remember, these are people being saved. And Dr. Agustin Lage Davila has led Cuba's Center for Molecular Immunology ever since its inception in 1991. He's made it one of the top institutions in the world for biotechnical medical research. He's a brilliant immunologist and an outstanding administrator. Very few people are both.
Well, okay, good morning everybody, and I have been requested to have a conversation with you about the Cuba fight to COVID-19, to coronavirus pandemics. Well, I have collected some slides and data in order to show what's going on here and what are we doing. First, let's start with numbers, because it is very good to start always with figures, numbers. And you see here some comparison of the world average and the data of some countries, and you can see in red below that figures corresponding to Cuba are not that bad. In fact, they are better than many other countries, even rich countries. And it's not a matter of comparison for the sake of comparison, but just to show you that the performing of the strategy that Cuba have developed for fighting COVID is producing results. I also know that people are very interested and focused in vaccine. But it is not good to focus exclusively in vaccine, because the result of the fighting of COVID in Cuba is not just a consequence of the vaccine. In fact, it's a multi-component strategy, and having mainly these 4 components that you have here in that slide. So first, the participation of the society, information policy, participation of all the people in that, work of the local government and so on. The second component is the public health system, that in Cuba, as you know, is 100% coverage of free public health. And inside the public health system is the primary care that is rather well developed since many decades ago. And then the other component is the pharmaceutical and biotechnology industry, and I will focus on that because, well, what is less known is that the biotechnology industry is part of the strategy of the country for fighting coronavirus. So these are the 4 components. Just to show this, maybe other colleagues can talk about the other component, but I will focus now on the 4th one. What is the role of biopharmaceutical industry? And this is what is the biopharmaceutical industry in Cuba. No? Right now there are 32 enterprises, that companies that have 80 production lines and more than 20,000 employees. So it's a rather big industry that have been created since the 80s. So the very first of these facilities are in the early 80s. It's rather early, in fact, because biotechnology is not at all worldwide. And it should be noticed that this effort of building a biotechnology industry since almost 40 years ago, is the basis on which we can construct now a strategy for fighting COVID. So all this existed before, well before COVID, and including manufacturing capacity. And it should be said that these institutions that you see here have been built in the 80s according to a concept of a closed loop facility. Closed loop means organization that perform research and manufacturing and even marketing and export. So it's an integrated facility, each one of them. And it's not just the research institute as classically considered. So these centers include good manufacturing practices and scale up manufacturing capacity and export right now. Not right now, export since many years ago to more than 40 countries. So you see here the pipeline, and note that vaccine is 32% of the pipeline. So it is a pharmaceutical industry that gives to vaccine and to prevention a protagonic role. It's not the same in many multinational companies worldwide, because pharmaceutical company, private pharmaceutical company that have been operated in many countries, market driven, so have been moving away for the vaccine, because what is more profitable is pills for chronic non-communicable diseases. But in our context, vaccines has always been a priority of Cuban biopharmaceutical industry. Now there are more than 100 projects. You see the distribution there, 32% are vaccine, but then we also have cytokines, interferon, monoclonal antibodies, and so on. So, by the way, there is a joint Cuba-Canada story in monoclonal antibodies, because we have been cooperated in that since many years ago, and in fact we had a joint venture company, Cuban-Canadian joint venture company operated in Ontario for more than 10 years. And there were clinical trials for monoclonal antibodies for the treatment of cancers going on in Canada. So there are roots of Cuban-Canadian cooperation before COVID. So, and in what concerns vaccine, so vaccination rates in Cuba, as confirmed by UNICEF and UNESCO, it's not our data, it's international organization data, is over 99% against 13 diseases. And 8 of these vaccines are manufactured here in the country. No, not a single case of measles since 1993, and meningitis B epidemics in the 80s was stopped by an innovative Cuban vaccine. There is a story of cooperation between WHO and Cuba for vaccination in other countries. And in fact, the Bloomberg report in 2019 ranked Cuba among the healthiest country in the world. So this is a story that should be said not for bragging here, but just to create a basis of knowledge on top of which we are going to talk about coronavirus. So these are the vaccines, anti-infectious vaccines that are part of the Cuban vaccination program for the childhood. And well, this is the story of diseases that were eliminated. There are many diseases that do not exist anymore because of the vaccine coverage. And this is the story of meningitis B that should be highlighted, because in the 80s we have an outbreak of meningitis B, and at the time there was no vaccine in the world available for meningitis B. There were vaccines for meningitis A and C, but not B. And the very first vaccine in the world was developed by Finland Institute in Cuba. And you see here what happened with the epidemics. They was completely stopped by vaccination. This is an important result that we are very proud of. And I used to tell in class to my students that you can work 20 years in your life just to see this picture for 20 minutes. So it's good to see that how vaccination works. And in this case, I repeat, vaccination is not the consequence of just purchasing an existing vaccine but inventing a vaccine that did not exist at the time. And this is the story of meningitis B. This is the story of hepatitis B. Hepatitis B vaccine is a recombinant vaccine. So it's a high technology vaccine. And you see the three lines that you see in the pictures corresponds to the incidence of hepatitis B below 15 years old, below 5, and in the whole population. And you see that the disease is disappearing. And this is another consequence of the vaccine. And this is a Haemophilus influenza vaccine. And this has also a Canadian connection, because there were joint research between Cuba and Canada for Ottawa University, I think, that participated in the research previous to the manufacturing of the vaccine. And you see what happened with the incidence of meningitis, not meningococcus meningitis, but in that case meningitis produced by Haemophilus influenza. By the way, this is the very first vaccine in the world that is completely synthetic. No, it's not the microbe growing in a fermenter. It's a chemical synthesis of carbohydrate that produces that vaccine, and the vaccine produces this result that you see that. So it should be noted that this is not a clinical trial. This is whole population data, so the complete incidence in the country. And in fact, Nature, that is a prestigious journal that everybody knows, qualified biotechnology in Cuba as the most established biotechnology industry in the developing world, in an editorial describing the evolution of biotechnology in Cuba. So it is normal then that having this basis, so that once the epidemics of coronavirus disease started, so this force, this research and manufacturing force were mobilized for fighting COVID. And you see that in BioCuba Pharma, that I forget to mention, BioCuba Pharma is the name of the group of industry of the pharmaceutical industry and biotechnology. It's like a holding organization of these enterprises. And in BioCuba Pharma, there are now 27 projects related to fighting COVID. So you see immunomodulators, antiviral, anti-inflammatories, preventive vaccine, diagnostic, even medical equipment. And 18 of these the product emerging from this research project have already emergency authorization by the Cuban regulatory authority, and 22 of these products are now in the phase of scaling up manufacturing. So you see some of them here. So interferon existed in the world many years ago, but Cuba started manufacturing interferon in '81, and then alpha interferon, and then gamma interferon, and then the combination of alpha plus gamma, and these products were used for early stages of the coronavirus disease. Then it comes biomodulina. Biomodulina is a peptide, a group of peptides derived from thymus that produce a stimulation of the immune system. Then we have the monoclonal antibodies. In fact, there are two monoclonal antibodies. In the picture you have just one. The monoclonal antibody that appear in the picture is an antibody against EGF, against epidermal growth factor, that we had developed in the 90s for cancer. But it seems now, according to the knowledge that have been produced in the research of COVID, that epidermal growth factor have a role in the physiopathology of COVID, and we are using that for severe cases. So, and then Husbinza is also a peptide that was developed for autoimmune diseases and has been redirected now for using COVID. This is called, in pharmaceutical industry, this idea is called reprofiling. So you have a product, you have data, the product is safe, but you have data for other disease, and then you evaluate if the product can also be used in this new disease. In this product, this was exactly the case. Then there are some of the Cuban biotechnology companies have a branch also manufacturing machines, equipment, and we are producing now ventilation equipment, one rather simple for non-invasive ventilation, and another one that is a high-performance lung ventilator. Of course, we have also machines like that have been imported. Some of them have been sent to Cuba thanks to the work of Solidarity organization. But we have also our own project for manufacturing these vaccines. And then we go to the point of the vaccines. There are 5 vaccines here, no? 3 of them, so that we call Soberana 1, Soberana 2, Soberana 1, Soberana 2, and Abdala have received authorization of the Cuban Regulatory Authority. The other 2 are in clinical research right now, and we have started vaccinations with our own vaccines, no? And up to now, and these figures are from yesterday, I updated yesterday the figure. So 17 million doses have been given to volunteers. 70% of the population in Cuba have received the first vaccination, and 40% of the population has already received the 3 doses plus 14 days of maturation of the immune response, and we can consider it vaccinated. And the campaign continues. You see the kinetics of vaccination in Cuba. So looking brown, the slope of the Cuban vaccination intensity as compared with US. And of course, in the US, they started first. They started in December 2020. We started later on. We started in July, June, July this year. But once we started, the intensity have been very, very fast, and some international databases consider the Cuban vaccination program of having now the highest intensity of vaccination per million inhabitants and per day, no, in the world. So then something should be said about the embargo, because all this effort is carried on in the framework of the economic hostility of the government of the United States, an hostility that has been kept intact, even in the middle of the pandemics. Something that someday the mankind should judge that from a moral viewpoint. So, and but you can see what their documents say. So the Cuban Democracy Act is for 9 of the United States well, government and legislation bodies come from 1992. So, and it says that export of medical supplies, instrument, and equipment to Cuba shall not be restricted. This is simply not true. So we have a tremendous evidence, or a long list of evidence of the embargo stopping the export of medical supply to Cuba. But moreover, the very same document says that there is an exception, except in the case in which the item to be exported could be used for the production of any biotechnology product. So in that case, the export to Cuba is restricted by law, and you can see that this clause of the exception for biotechnology product include vaccines. So specifically and explicitly, the legislation approved by the U.S. government forbids the export to Cuba of a product to be used for manufacturing vaccines. So how to consider that, how to evaluate that, how to judge that from an ethic point of view. So well, I leave you with the question for you to answer. So finally, well, that's it. And I leave you my email here in case that any one of the audience can send a question. I will be more than happy to answer, or to connect you with the people that can answer any specific questions. Thank you very much.
Dr. Samira Addrey, could you maybe take this opportunity to update us a little bit about Cuba's vaccination campaign, which, as Dr. Lage said, is proceeding faster than any other in the world in terms of rates of vaccination?
Yeah, I think his presentation was excellent, but just so the audience knows, it's a pre-recorded message, precisely because of the complexities of having a live connection, as we saw with Dr. Mas Bermejo. So Dr. Agustin Lage had to do a pre-recorded message, and the message he made was from, I think, September. So Cuba has advanced significantly over these past few weeks in terms of vaccinating the population, and it's incredible. I mean, 99.3% of the population of the population that can be vaccinated has received at least one dose of vaccines. That's huge, and that's including children. Let's remember that children ages 2 to 18 have began to receive vaccination, and they're almost done with the pediatric population, to be very frank. And the goal of the Cuban government is to have 90% of the population vaccinated with all 3 doses by the end of November. So that's within a month, 90% of the population will be vaccinated. That's huge for a country that has had to weather the storm of not only this blockade that's been a stranglehold, especially in these recent years, but under this pandemic, under economic, constraints. It's remarkable, and all because of beautiful, giving people like many who are on this call, who contributed to Savings Lives campaign for buying syringes to be donated, and contributing from all over the world, different solidarity movements contributing syringes so that Cuba could meet its goals of vaccination. And it's a moment for us to all really pay attention. That for me personally, learning from the Cuban example is that we talk about things when things have, really come full circle, when things have become successful. You don't boast about what you can do like what most of the developed nations have been doing. Their whole systems are based on profit, and they think that they can move ahead of everyone. But we're seeing the tangible results of being a society that's serious about doing something and actually doing it versus those who talk a lot and don't do anything. So I'd say the vaccination campaign is just another huge notch on Cuba's phenomenal medical history.
That is truly amazing. And as someone who's been following the statistics since the beginning of the pandemic, both for the US and for Cuba, I know that the vaccine campaign is working because Cuba's daily infection rate is less than 1/5 what it was at its peak. Yeah, it's an amazing campaign. Well, what else do we need to know about the vaccines? How does Cuba plan to share these vaccines? Have they already begun sharing them with other countries that don't have access to, clearly, the COVAX program has not worked to vaccinate poor countries. The vaccination rate in Haiti, the number of people that are fully vaccinated is less than 1% of the population. Nobody's going to step in except Cuba. What have they done?
Certainly, they have stepped up, and they've always said clearly from the beginning of this pandemic, the intention of Cuba was not only to protect its population, but to produce enough vaccines to be helpful to other countries that would need it. And so far, we have seen news of shipments to Nicaragua, to Vietnam, of vaccines. And this is pending, the OMS great approval of a vaccine. We don't know what the holdup is. We know that Cuba is in the process of getting these vaccines approved. We don't know what the holdup is, but I think it is rather strange, as Dr. Tedros is blasting the developed countries right now for the lack of vaccine equity and holding up the process in getting vaccines to more and more countries, and yet you're holding up the process of approval for the country that's been ever ready to fill in that void. And so it's crazy. And I saw recently the stats on health workers around the world who are not vaccinated because of this lack of vaccine equity. Health workers who have to be on the front lines, not vaccinated, just because, we have big pharma holding on to intellectual property rights. That's crazy. 115,000 lives of health workers alone have been lost. That's just people who are dedicated to this job of saving lives being used as pawns because somebody else wants to wait to make profits.
OMS, by the way, are the siglas, the initials in Spanish for the World Health Organization of the UN. Allison has given us the word that she has Dr. Masbermejo on the line. Dr. Masbermejo, can you update us a little bit on what's going on now in Cuba?
Can everyone hear me okay?
Yes.
Okay, we have a bit of a echo chamber. It won't happen again, but we are going to go ahead and share from a different program, Google Meet. We are connected with Dr. Masbermejo, and we have his presentation. So I'm going to share screen, and I think this should work out just grand for us all. Thank you again for your patience, and we'll go ahead and start it now.
Now,
Okay, Dr. Moss, go ahead when you are ready.
ready?
Yes, please.
Okay, thank you very much. Thank you very much for the patience, and it's a very difficult situation, but we will go ahead with this presentation. And thank you again for the invitation. It's a pleasure to me to be here and to share this presentation with you. Will be the first but not the last. And please, next. Well, next. Well, yes, this is since the beginning of the outbreak of the pandemic, sorry. We started in Cuba working with preventive and therapeutic measures adopted for case detection, recovery of confirmed COVID-19 cases in Cuba. And as you can see, it's like stairs. And we started for the first step, is for the healthy population. And the idea is to keep this population avoid to getting sick. And we did a very big effort to activate the case detection. And on the other hand, we use preventive medicine that we have in Cuba because the pharmaceutical industry. And with the confirmed patient, we try to avoid that they getting worse. And for this moment, we treatment the earliest stage and use innovative medicine from the biotech industry in Cuba. And for the serious and critical patient, we keep them and to try to avoid that they die because the COVID-19, and we use immune modulators that we have for the Cuban biotech industry. And finally, for the patient, the convalescent patients, we try to minimize the long-term effects, and we did a personalized treatment, monitoring, psychological support, rehabilitation, regenerative therapy, and followed by specialists. During the pandemic, I have to introduce that the Trump government increased measures to put the blockade wars, and more than 200 new measures to increase the blockade were established. Next, please. Well, in this chart, you can see, I don't know if you see well, they see well? Yes, okay. This is the cure of the pandemic in Cuba since March 11, 2020, that we started with the first case. As you can see in the chart, in the year 2020, we started we have no cases, very few cases, and we can manage the pandemic very well. But after November 20 of 2020, we opened the borders, and after that increased the problem and increased the number of cases, the number of deaths, and in August and September of this year, 2021, we have a big peak in August, as you can see, August and September, after the introduction in Cuba, the Delta strain. And the peak was more than 9,000 cases per day, and the evaluation, some about the people who died daily, we have more or less between 80 and 90 daily. But after we introduced new change and of course the vaccination campaign, the case drop up. And today for example, today we have just 1,500 cases and 20 people who died because the COVID-19 disease. And the fatality rate all the time keep it in around 1%, and that is a very good number if you compare it with the rest of the world. Next, please. Well, this is our priority during the fight against COVID-19, and I don't know, maybe you are not aware the big challenge that we have with the vaccine, because since the beginning, the president decided to join all the scientific community, and ask them to start with the Cuban vaccine, taking into account that our biotech industry had previous experience with hepatitis B vaccine, with the meningococcus vaccine, and very, very soon, all this scientific community started with the movement in order to prepare the Cuban vaccines. After 1 year, more or less, we have now 3 vaccines and 2 vaccines candidates. Finally, the vaccines are, the vaccine used for emergency uses, Abdala and Soberana. You have the 2 type of vaccine. If you see, after the very, very hard clinical trials, the outcomes with both vaccines for the efficacy against infection is, as you can see, 75.7% in Soberana. In Abdala, for symptomatic cases, 92%, and in Soberana, 91.2%, and for the severe and symptomatic disease or death, it means to prevent that, was 100%. After that, we are following different type of studies, and we are preparing some papers to publish the outcomes. These outcomes, this is the clinical trials outcomes, but we have also the impact of the vaccine in the population, and the efficiency of the vaccine is around 92% for severe cases and 90% for to prevent death. And as you can see, in October 18, 2021, means that we have full vaccination in the Cuban population, 79.7%, and today we have 70%. This is a very, very good data, and we have now the impact of the vaccine very clear, and we are almost with the control of the pandemic. But what happened with the vaccine? Next, please. If you have the vaccine, but you need people to, nurses and doctors to put the vaccine to the Cuban population, and the big challenge was that, but we have a very good primary health care system, and we use and mobilize all the consultorio of family doctor, and it was a very, very good idea, but the government and the health system use the doctors and all the health sector workers and in very short time we use vaccines until, as I mentioned before, 70% of the population, and we are planning to finish the vaccination for a Cuban population as a whole in this November 15. And the other thing that I not mentioned yet, but I have to speak about, is that we started with the children since 2 years to 15. I think that is the first country in the world that vaccinated all the population before opening the schools, I mean primary schools, secondary schools, and university as well. Next, please. Well, the role of the health actors, according to the Cuban experience, is that the governmental institution organize and control the national strategy of epidemic response, overseeing the minister and other state institutions. And the plan is the national strategy was prepared on January 2020. At the very beginning, we received news from the China, Wuhan in China have the problem. The government decided to prepare the plan that we are using today and we used before since the beginning of the cases. And the Ministry of Public Health leads the national health system based on primary health care, as I said before, and with community level care and polyclinic, secondary care with nursing homes, physical and mental disabled institutions, and tertiary care for provincial institute and other scientific facility enforced by health action, fully supported by the community. I have to mention that during the pandemic, since the November, as I said before, November 20, in 2020, we had many problems because they reported more and between 5,000 and 900 cases daily, and was a big challenge for the Ministry of Public Health and for all the Cuban population and for the government. And we have to work very hard to keep all the population under the healthcare sector, at hospital, at the polyclinics, and we mobilize a lot of persons and institutions in order to keep the population in the best situation according to the problem of this very difficult disease. Well, the main next, please. The main issues involved in the strategy is of course, the first is the community involvement, because you know that in the world this is a big problem because the people refuse to receive the vaccination. And if you don't, if you are not able to prepare a very high numbers of population with the full vaccination, it's very difficult to control and to decrease the number of cases, of course, the mortality rate and so on. The other thing is the intersectoral collaboration and the participation of all the socioeconomic sector, because I have to say now that during the pandemic we have a very difficult economic situation. We have a problem with the shortage of foods. We have a problem with the many things about the daily behavior of the people, and this situation was very difficult, and the government have to adopt many many different measures and rules to avoid the very complex situation that we have. The Cuban, the other thing is the Cuban public health. The national system is a health system based on primary health care, and that's we can because if you have a very good industry and you don't have the people to put the vaccine in the right time, it's a complicated situation. The other thing is the political will, and the last one, but not the less, is the epidemiological and scientific approach. This is from the beginning with the vaccine, with the epidemiological approach, with the daily evaluation of the situation of the pandemic, what thing we have to do, what the next thing, the next problem that maybe we will have in the future, the prognosis of the cases and the, of course, and the in the time, how many cases we will have to prepare the resource, the human resources, the hospital, and of course the different treatments and so on. Well, next please. The pandemic challenge for the health system, well, all of us knows that the main epidemiological and clinical characteristics of COVID-19 pandemic presents a great challenge for health system and disrupting public health and public service, economy, and general society. It seems to me that it's the worst pandemic since the big influenza pandemic in 1980. Therefore, in this condition, epidemic control is challenging, especially with the airborne disease, implementation of unusual and extensive prevention and control measures, not always as effective as once considered, are difficult to put into action effectively. And the pandemic challenge and the nationwide circulation of SARS-CoV-2, highly contagious environment, new variants as Delta, as mentioned before, the problem what we have with Delta, because the transmission with Delta increased, and if you increase the case, it's a big risk to expected to have more people who die, and decrease the effectiveness of public health and social measures, as well as available diagnostic vaccines and therapies. And this with Delta was the challenge for us, and we were prepared, but we, even with the preparation, even with the prognostics that we had with at that time, was a big challenge for the health system. And the other thing is the little effectiveness of movement restriction and other measures aiming to reduce the airborne transmission. Airborne transmission is difficult, and helpfully we introduced the masking, to use the mask and in Cuba, and the population accepted, and as well as decrease of population risk perception due to prolonged time. It's a pandemic fatigue. Some people mention this situation like this, and the positive vaccine effect expectation. And one thing that, because the shortage of food, the difficult situation for the population to find food in the middle of the pandemic, growing of people in public health and other spaces. Well, finally, we were, next please. No, next. Thank you, this one. Well, what is going to happen after that? Well, the problem is the equity. It's in Spanish. It's a PAHO paper about the problem with equity after COVID, and what is going to happen in Cuba after that. Well, we are preparing now the post-COVID of the new normality. There are different concepts in the world about this. What now the preparation for the post-COVID is almost finished, and we are also analyzing when we have to introduce a new doses of vaccine. We are on the epidemiological study of the vaccine impact, and to work with them, with the people who produce the vaccine, in order to decide when we introduce the new booster of the new vaccine booster. Next, please. Finally, I'm going to speak about the next, please. Thank you. This one. I am going to speak about the Cuba's response conclusion, and I have to say that the strategies, in particular, in Cuba's epidemic response, included building of universal character of the health system and its strong primary health care network, but carry out nationwide door-to-door, is a Cuban experience, door-to-door screening for persons with fever and respiratory symptoms, isolating confirmed cases and placing their traced contact and suspected cases under quarantine. The isolating cases and contact was a measure that we use in the peak of the pandemic, and this gave us very good results. The other thing is the early inclusion of the researchers and scientific institutions to design and structure of the strategies adopted. I finally have to say the role of the government with the dealing with the leadership of the president and the Council of Ministers, that they were very, very hard with the scientific community, with the population, with the health system, to avoid that this big problem in Cuba was difficult. And the other thing is that how the government managed all the health institutions, the scientific institution, to control the pandemic in Cuba, as we have now, and we are now preparing a new package of research to follow the next step in the pandemic. Well, that's it. Thank you very much. And after this hard time that we all had, I finish my presentation. Thank you very much.
Thank you very much, Dr. Mas. I will leave on the screen information for a second about how you can be in touch and follow his important work and that of the Cuban institutions that he represents that have been leading the way in the worldwide fight against COVID-19. As a reminder, Dr. Mas Bermejo is the leader of Cuba's COVID-19 National Technical Group. For this section of our program, I'm hoping you might be able to shed some light and offer some reflection on Cuba's medical internationalism. Cuban vaccines have been sent to Venezuela, to Vietnam, and to Nicaragua. And as I understand it, there are plans to send them other places as well. Do you have any thoughts about the importance of Cuba's vaccines being sent internationally and any plans, any information about the plans to do so, Dr. Mas?
Well, as far as I know, we are sharing the vaccine with Venezuela, with Nicaragua, with Vietnam, and we have a conversation with different countries to share the vaccine. Of course, Mexico as well, and there are many interests in the region, and for this reason we are finishing many clinical trials, and we are introducing the vaccine in the WHO, and now they are in WHO list, but we have to pass many different steps, and some we have to receive a delegation with WHO, but we are in the process to qualify the vaccine by WHO.
Thank you. Thank you, Dr. Mas. I am going to share a different screen so that everyone can see your face, and thank you for your presentation. Lenny, do you have any follow-up questions? Or Samira, do you have anything you'd like to add?
Well, I just wondered if you would like to talk a little bit more about how the blockade has had an impact on Cuba's ability to fight COVID-19, as well as on the healthcare system in general. Dr. Samira, would you be up for that? Because I think we have, or Dr. Mas Bermejo, I am not sure if he's still on the line.
I can hear well. I can hear well the previous. Yes. Oh, yes. Well, I mentioned, but briefly, but the blockade was terrible. You know, during the pandemic, with the Trump government, they increased the measure for the blockades in more than 240 measure, and it's terrible. And on the other hand, it's a problem with if you want to buy the equipment, and this equipment have something with the US component, is very difficult, and you have to sort out different ways how to buy this, and sometimes you have to buy the equipment very far. Even with for instance, for the PCR test, we have to buy at the beginning. We have in Cuba four equipment to do PCR, but the government decided to put one equipment in each province, not just for the COVID-19, even for the future. But to buy this type of equipment, it was very, very difficult, because the problem for the And you know, at the end of Trump presidents decided to put it in the terrorist list or something like that, and this was worse. Many banks stopped the business with Cuba, and was terrible. And this give to us and the scientific people, even with the vaccine. When we did the scientific prepare the vaccine, you need resources, you need raw materials, and to find raw material for the vaccine was very difficult. It's terrible as usual, but this time is more complicated and more terrific for the using a pandemic like this, like with the political measure to increase the problem in the Cuba population.
I think many people don't realize the extent and extraterritoriality of the blockade. So they say, well, why doesn't Cuba just buy from other countries? And they don't realize that the US has control of the world's financial system and that they can attack in so many different ways, you know, through financing, through the insurance on the ships, through the shipping lines themselves. And they can essentially cut off Cuba from the supplies and raw materials and financing that they need. So I open this question for all of us. What can people in the US, in Canada, and in Quebec do to fight against the blockade?
Dr. Samira Addrey, I'm wondering if you have some perspective you might be able to share on that question. And also, I think it's important to understand that although the US blockade says that they exempt medicines and other like much needed goods, we know that this isn't true. So if you could share some light on that as well, I think that'd be important.
For sure, I'd love to. So first, about this blockade and its impact on healthcare, particular, it's crazy. I mean, you have organizations like Oxfam who've studied the situation and laid out report in detail. You even had a committee that was, I believe, led by former President Jimmy Carter go and study the impacts of the blockade on the Cuban people. And I think his report was like 300 and something pages. And that was in the year 97. And all of this detail about how this truly does cripple and paralyze the Cuban healthcare system. The blockade is intentional in every aspect of its paralyzing the Cuban healthcare system, because they have outlined law after law. For example, the Helms-Burton Act in 96 that would start to charge third-party countries or entities for doing business with Cuba, which is a huge roadblock. A huge roadblock when you pitch the story to the world that Cuba's the blockade is only to stop trade between US and Cuba, but yet years later you have a law like Helms-Burton that would penalize and has penalized companies for doing business with Cuba. For example, I think there was one biotech company in the US that through its agreement with UNICEF sold 3 children's vaccines to Cuba instead of the one that it had a license to do so, and was fined $164,000. I mean, maybe that's peanuts to some biotech company, but still that's a loss and a serious consequence for doing something that is right for the pediatric population in Cuba. And that's just one example of many other examples that have happened to drive people away and disincentivize people from doing business with Cuba. And then, for example, also before that, the Torricelli Act coming up and saying, you know, ships, if they dock in Cuba, can't dock in the US for 6 months. Who's going to want to do business with Cuba if that's the penalty that they have to pay? And what we always have to remember is this economic blockade, which is cruel, malicious in every aspect of the word, is it causes a situation where Cuba has to pay an enormous price for the same resources, higher prices for the same resources, unless the blockade didn't exist. So for example, if it does business with European Union countries that offer certain services, it's paying at least 30% more than it would pay without the blockade. And for a poor country, everybody remember, Cuba is a third world country. It is not rich. So this kind of enormous cost on a small island is ridiculous. And it's just by the savvy and the humane aspect of Cuban government and people to focus its meager resources on what really matters, which is sustaining human life on the island. Yes, it uses, you know, quite a bit of its GDP to keep up the health infrastructure, but not nearly as much as we waste in this country. We really waste, and we still don't have the health that we boast to the world. So it's incredible, and people have to understand the blockade is insidious and it is evil, because people are so used to seeing like the violent representation of war and you know, just how I guess war can be seen physically with bloodshed and all that, but don't seem to understand how this blockade impacts every single aspect of life. Children in Cuba with school resources, just scholastic resources, pencils and paper, have to use, you know, cheap, whatever Cuba can buy, which may be of cheap quality because that's what they can afford, but they have paid an enormous price for those resources to be on the island. And who's to say that because of that, these students don't excel? They excel. Contrary to popular belief, it doesn't matter the lack of quality of resources that they have to deal with. They are very smart and very capable. So the blockade has created a situation where Cubans have had to thrive despite, you know, the boot of the US on its neck. But it is ridiculous. This cannot keep going on, and especially at the cost of trying to strangle one of the greatest aspects of Cuban structure, which is the healthcare and its promise to deliver healthcare as a human right to its people. So that was the first part of the question, right? and then, I mean, the second part of the question, please remind me, because I've gone about the blockade. The second part was,
what are we going to do about it? I think we're going to have to make it more politically costly for people to attack Cuba than for people to, you know, defend Cuba. Yeah.
What are we going to do?
It's going to be a lot of organizing.
Yes, we definitely have to organize. That is a key point. And it is amazing to me that, you know, activists like you have been in this fight for everybody on this panel, Allison, Lenny, Sean, for so many years, for decades in this battle. And it's amazing the strides that you've made, but yet still administration after administration, or as they like to use the word, regime, Biden regime, Trump regime, all of them, they use it negatively when it's not America, but they don't want to use it when it comes to America, the United States. These Democratic and Republican regimes are all doing the same thing. They do not want to change their policies when it comes to Cuba. And we all need to understand that this is not to any of our benefit, because Cuba is a stronghold of information and resources that we all can learn from and benefit from. We need to first organize ourselves, approach our leadership, and call them out on these errors, especially during the pandemic. Continuing this kind of policy is contrary to human goodwill, right? And not only that, we need to break down these barriers of the blockade, travel to Cuba, get to know Cubans for ourselves. There's so many brigades and groups that are going to be traveling, especially once the country opens back up in November 15th. I encourage you, I've seen that the Che Guevara Brigade is going to be going down in November. Thankfully, IFCO Pastors for Peace is also going to be going down in November. We'll be the first, which is a huge blessing. We'll be there, but there's going to be so many brigades. The May Day brigades will pick back up. In year 2022, we must massively go to Cuba and show the US government that it cannot dictate what we do in terms of people-to-people outreach and our support of the Cuban people. All these policies that have been put in place to essentially force democracy that does not truly exist, not even here in the United States, on other people. We need to make people understand that we are aware and spread the word. Each one teach one. Any tidbit of information you have, teach somebody else, because what we also need to understand is we have to be in this combat of readiness to fight the misinformation that has been, out there about Cuba for ages. The misinformation campaign, the media campaign is real. And I would say, word of caution, please, anybody who watches these mainstream media outlets, don't watch them, because they are just psychological warfare, pumping us with lies, and it's not going to help you if you really want to know anything about what's going on in the world. So our struggles, whatever our struggles are in our respective communities, we must make it internationalist. We must make ourselves able to understand that other people are going through similar, if not worse, situations, and be allies, but more than that, be comrades in the struggle for a better world. So what we can do is support Cuba in its right to be sovereign, decide for itself, and choose the way it wants to roll out its way of life. That's fundamental. So there's so much we can do, but we definitely have to organize. We have to teach. We have to educate. We have to eliminate the lies. We have to travel. Please get passports. Go out there and learn. So, and don't let anything be a barrier. Not language, not anything.
It's especially important for people of color to get passports. The passport having rate for people of color is so much lower than among the Anglo population. Get your passport so you can go to Cuba, because after you see it for yourself, you don't have to believe a word we say. You just go check it out for yourself, then you'll know.
Yeah, very true. Seeing Cuba for yourself is extremely important to building solidarity. And I see people posting in the chat lots of important information about brigades. We'll announce them later also, but please do, if you know about a brigade coming up to Cuba, whether it's the Ernesto Che Guevara Volunteer Work Brigade of the Canadian Network on Cuba, Pastors for Peace, Code Pink, the Venceremos Brigade, the Calixto Garcia Brigade, which is also out of here in Canada. Join a brigade and get to Cuba when you can. We're going to take a minute to show what you were just talking about, Dr. Samira Addrey, videos helping us break through this media blockade against Cuba, making it impossible for people in the US or Canada to actually understand what's happening in Cuba by looking at the news. So there is a new media organization called Belly of the Beast that has been doing some really groundbreaking and important work about breaking those media lies against Cuba. And they've released 2 short videos about the impact of the blockade on Cuba's healthcare system. And they're also preparing to issue their season 2 of a series of episodes called The War on Cuba. So I just wanted to thank all of the journalists with Belly of the Beast working out of Cuba and show these 2 very short videos to give us another perspective on the impact of the cruel over 60-year-old US blockade on the country. And then we'll go to a few questions to Dr. Mas that I've seen in the Q&A before we wrap up tonight's excellent program with some really important announcements.
My name is Mitchell Valdisos. I'm the director of the Cuban Center for Neuroscience. Usually do work on neurodegenerative diseases and childhood disorders of the brain, but lately we've been using the technology we have here to manufacture equipment and different materials that are needed in the COVID response. So I hear people saying the embargo has no effect on the Cuban health system, and this is not true. I can give 3 examples from our own work. So the third thing is that Cuba traditionally has imported. There were these Swiss companies that used to sell to Cuba ventilators, but they were acquired by US companies, and they said that they couldn't supply anymore to Cuba. So our government decided on manufacturing ventilators, emergency ventilators, and we were buying raw materials to manufacture. The ventilators we're manufacturing, the best motor is from the US. We cannot buy it directly from the US. We have to go buy it from somebody that buys it from somebody and that buys it from somebody. And this makes it more costly. It takes longer to get here. The second example is we're manufacturing the swabs that are used for the PCR tests. And we wanted to buy a packaging unit from a German company to automatically package the swabs. Everything was going okay until Cuba was placed on the list of countries that sponsor terrorism. And this German company just said, we can't sell it to you because it's too complicated for us. It'll get us in trouble with the US. And they simply dropped it. We had to start searching for another supplier and go through all the process, and that can take months. The third example is that we also started manufacturing here in the center surgical masks. And we had a sale in Europe of this material lined up to send to Cuba. And just a few days after all these protests, they decided to double the prices. And I think this was politically motivated. This is an indirect effect of the embargo. And we finally decided to buy the material in China, but now it will take a few months to get here. The embargo is costing lives because Cuba has an excellent health system, despite whatever the US propaganda can say. And if we were able to work at full capacity, it would save many lives. Lift the embargo, and that's the best help for the Cuban people.
Mi nombre es Tania Urquiza Rodríguez y ocupo el cargo de vicepresidenta de BioCuba Pharma. De los 619 medicamentos del cuadro básico, la industria biofarmacéutica cubana produce el 58%. Cuba cuenta con una industria farmacéutica robusta, pero las empresas de BioCuba Pharma han estado siempre muy afectadas por el bloqueo. Y si se afectan las empresas de BioCuba Pharma, se afecta el Sistema Nacional de Salud y se afecta la población cubana. El bloqueo de los Estados Unidos hacia Cuba tiene más de 60 años, pero realmente durante la pandemia, en el año 2020, se recrudeció. Hemos tenido proveedores que han sido amenazados de que van a ser sancionados. Tenemos ejemplos de navieras, de aerolíneas que nos han dicho que no pueden continuar trabajando con Cuba por el bloqueo. Durante más de 30 años, una compañía europea importante nos estuvo suministrando sus producciones para la biotecnología. Y el año pasado, en medio de la pandemia, pues nos ha comunicado que tiene que suspender las entregas hasta que no se revise que esos suministros contienen menos del 10% de los componentes de origen de Estados Unidos. Esos suministros están detenidos en este momento y está afectando algunas de nuestras producciones, sobre todo la vacuna soberana contra la COVID-19. Aquí se pone en evidencia entonces la extraterritorialidad del bloqueo de los Estados Unidos contra Cuba. Les puedo leer un correo enviado por un suministrador que hasta ahora nos estuvo enviando materias primas para hacer antibióticos, antihipertensivos. Las presiones del bloqueo norteamericano hacia Cuba han provocado que a partir de hoy el banco donde tenemos nuestras cuentas suspenda operaciones con Cuba. Otro de los ejemplos concretos que tenemos, 3 contenedores de 40 pies de bulbos necesarios para poder vacunar a millones de personas en un puerto listo para zarpar con la naviera MSC. Esa naviera el 21 de junio mandó un comunicado oficial diciendo que ya no era posible tocar puerto cubano. Hay insumos que solo se producen en Estados Unidos, pero nunca lo hemos podido adquirir directamente desde Cuba. Tenemos algunos ejemplos como los antibióticos betalactámicos. Se llevan hasta un puerto intermedio en Europa, se vuelven a montar entonces en otro barco hasta llegar a Cuba. Cuestan entre un 30 y un 50% más. Esas divisas no las podamos destinar a la compra de otras materias primas para otros medicamentos. no solo el costo, sino también en esa logística trae consigo entonces que se demore aún más en llegar hacia Cuba en medio de la pandemia. Los científicos, por ejemplo, compartieron en las redes su información de manera abierta. Los países empezaron a organizar ayudas humanitarias, las brigadas médicas cubanas, cómo viajaron a otros países como nunca, inclusive a Europa, en medio de toda esa cosa tan bonita, Estados Unidos, lo que hizo fue recrudecer el bloqueo. Por eso decimos que es un bloqueo genocida y cruel, porque al final mata.
So that is belly of the beast, very important information. Sorry, Dr. Lenny, I think you were speaking too. But I wanted.
I'm not saying. I know belly and the best and the beast.
So I'm going.
I met them here.
Fantastic. Dr. Mas is just telling me he knows belly of the beast and met them while in Cuba. So I have two more questions for Dr. Mas, and then we'll go on to the kind of closing portion of the program. I know it's been a long night, especially for Dr. Mas and those of you on the East Coast also. Dr. Lenny and I are here on the West Coast, so we're much earlier in the evening than you all. But I did want to take some of the questions from the chat. So I have two questions for you, Dr. Mas. One, what is the experience of breakthrough illness in Cuba, meaning that people in Cuba are still getting, that are vaccinated are still getting the virus? And two, what are the steps in getting the vaccine to be recognized by the World Health Organization? So I will, if you'll give me a second to share my screen. Don't start quite yet. 1 second, please.
Yes. Ready?
Yes, now.
Okay. Well, the first question, I have to say that first of all, that the vaccines not prevent the disease by itself. They prevent the people who they prevent two things: the very critical disease and the death. Even though in Cuba we have cases fully vaccinated, yes, we have. But we are doing our research now, and we are evaluating the effectiveness of the Abdala, and the work that we have done in the last 2 weeks shows that in the case of Abdala, in Havana province, one study that we did 2 weeks ago, we finished, the vaccine prevent 90% of the critical case and 92% of the people who die. Means that if you are vaccinated already, you have just 90% to prevent that the disease became critical. If you have the same thing, that means that the risk to death means that is 92%. That's the idea. But we are conducted a study because we have experience, as I mentioned before, with another vaccine. And we are very proud that Cuba is the first Latin American country that has our own vaccines, and we are administered to all the population in Cuba in the 15th of November. It's the first country in the world, and I have to mention that. The second question is, what the steps are getting the vaccine to be recognized by WHO? It's not easy. It's not easy. Takes time. There are some interview with the PAHO representative in Cuba, and he explained it very well that, but I have to say, the first thing is that you have to prepare a meeting with the WHO and PAHO saying that you want to recognize the vaccine by WHO. And then after that is the first step. This step was done by the people who produce the vaccine. It's, the Biotechnology Center and the Finland Institute. This meeting and two more meetings means that 3 meetings with WHO and PAHO, preparing everything. But the next step will be that they have to come to Cuba to go to the good practice of the production, and there are many things in this process. Today I checked the list in the that PAHO recognized as vaccine, and there are not but about 10 vaccines that they recognize. There are more in different steps, and we are in the list. I mean, Soberana and Abdallah are in the list, but still in the first step. We are expecting is takes time, maybe half a year, maybe a year, depends of the if the people who have to come to Cuba are available, and we have to be sure that our good practice of the production are ready, and we are clear about that, but we have to be sure because we are receiving people who are in charge of to make a very carefully revision about all the vaccine process. But the answer in short is yes, we are in the process. We had 3 meetings already with the WHO and PAHO, and now we are in the next step meetings. They asked for some papers, for some studies, but one challenge that we have, even at the same time, that we have to publish our resources in international journals, because it's one very important thing that we are doing now. We are preparing articles for Lancet, American Journal of Public Health, and different journals, international journals that give us a very good record for the vaccine be included in the WHO list. Thank you.
Thank you very much, Dr. Mas. It's really been an honor to have you with us here tonight. Such a prestigious doctor. You are well traveled and experienced, and it's really, we've benefited so much from your knowledge today. And thank you for your patience and getting all of the technology to work. It has not been easy, as we know, due to the US blockade, but from Canada and the United States, from here in the belly of the beast, we really appreciate your helping us to break the information and media blockade against Cuba that prevents our exchange people to people all of the time. Thank you.
Thank you for your friendly, and I am very proud to share with you this time, even the hard time that we had, but forget it. Thank you very much.
Venceremos.
Hasta luego.
Okay, I think I've successfully gone to this platform now. Really, what an excellent opportunity for us all. And we still have a few more announcements. And of course, I want to hear closing comments from Dr. Samira Addrey. But I did want to give people an important update about the Saving Lives campaign that's hosting tonight's webinar. Saving Lives campaign came together from including people from LATAB, the Concertation et Solidarité Québec-Cuba, as well as the National Network on Cuba and the Canadian Network on Cuba, coming together in order to raise awareness about Cuba's leadership in the fight against COVID-19 and how actually people in the United States could benefit so much from Cuba's vaccines, Cuba's medical system and understanding of health as a human right, and how the blockade prevents that kind of exchange, especially during a pandemic. So 6 months ago, I will say this report comes from, of course, the Saving Lives campaign and Bob Schwartz with Global Health Partners, who's been integral in getting the Saving Lives campaign off the ground and in delivering the syringes I'm going to talk about right now. So 6 months ago, the Saving Lives campaign launched one of the most important efforts in our history, our long history in solidarity with Cuba. We committed to raising funds to send syringes to Cuba to support their mass COVID vaccination campaign, setting a very modest goal of $100,000. But thanks to the enthusiasm and support from many of you, the campaign raised more than $650,000 and enabled us to purchase and ship more than 6 million syringes. All 6 million syringes, 8 40-foot containers, have already arrived in Cuba and ensured that they would have enough syringes to fully vaccinate their entire population, as we see unfolding in front of us today. In addition, these funds enabled us to purchase PPE, personal protective equipment, the very same equipment our frontline healthcare workers were desperately seeking in the United States only 1 year ago. So the Saving Lives campaign will be sending another 6 full containers filled with disposable masks, face shields, gloves, gowns, disinfecting solution, and wipes to protect Cuban doctors and nurses who are treating COVID patients or who are participating in vaccination efforts. All of this donated PPE will arrive in Cuba before the end of the year. Our solidarity comes at a critical moment, with the US tightening the embargo against Cuba, making it almost impossible for Cuba to buy essential medicines and the reagents that they need to produce COVID-19 vaccines. Our efforts, Saving Lives, help to reopen the island and build a stronger and broader movement against the blockade. I'll say that it was also an inspiration to people from other countries, including Canada, which also raised a large amount of money to send syringes and medical equipment, and including many other countries around the world that have shown up for Cuba and found a way to get around this criminal and murderous US blockade. And I think it's very important, the note about helping to build a stronger and broader movement against the blockade, because that is always front of mind for many of us as activists in solidarity with Cuba who want people to understand and know the reality of Cuba. I will say that we were hoping tonight to have a speaker from Project PAN, which is the next project that is being supported by the Saving Lives campaign. Project PAN, or Proyecto de PAN, is a project of Cuban Americans based in the Cuban American community to send more much needed supplies and goods, including food, to Cuba in order to combat the increasing pressure of the US blockade. So there's a link that's been put in the chat about how you can donate to this important project, and keep checking your email for more information. And we encourage people to please support and give what you can. We're going to do a few announcements as we move towards the ending part of our webinar tonight. And I want to pass it over to Dr. Lenny Reeves to share about the next important event coming up.
Next webinar is going to be on November 7th, and it's going to be the Cuba and Africa film launch. And this is going to be incredible. As most of you already know, as Angola began to achieve their independence, South African troops poured over the border. Angola called for help, and Cuba answered. And this is a film called Cuba in Africa. It's by Nagash Abdulrahman, and it's the dramatic untold story of the 420,000 Cubans, you know, soldiers and teachers, healthcare workers who gave everything to end apartheid, to end colonialism in Africa as best they could. It's got a super all-star cast. In addition to the producer and director of the film, the Cuban ambassador, Ambassador Lianes Torres Rivera is going to be there. Rosemary Mealy is going to be there. Isaac Seni is going to be there. And Piero Glageses, who wrote the books, believe me, on the scholarly tomes about Cuba's effort in Africa. And in addition to these scholarly books published in English, he co-wrote with Jorge Frisquet, who was commanding the Cuban forces in Africa, this book. So this is a dumb mess. We're not going to have another chance to see such a great presentation about Cuba's incredible effort in Africa. As one of the veterans said, that we heard on a recent caravan, he said, this time there was again ships full of Black people crossing the ocean, but this time we were armed.
Important difference, and really an important story to learn about now. Cuba's internationalism is not only medical internationalism with the Henry Reeve Brigades, which have been around the world, or Cuban doctors fighting Ebola, but also in helping support liberation movements and to end apartheid in South Africa. So it's important we tell that story over and over again. I'm really looking forward to that event, and we'll show the trailer for the movie just to offer a little push for people to watch their inboxes for the announcement to the invite for November 7th. We'll show that as we close out tonight. I wanted to also just give a brief announcement about the March conference. Again, the campaign, the International US-Cuba Normalization Conference Committee is organizing a hybrid in-person and of course on Zoom and online conference March 18th through 20th in 2022. So this is will come 2 years after the originally scheduled in-person conference that was canceled due to the COVID-19 pandemic. Of course, we'll keep in mind any developments with COVID and public safety will come first, but we're looking forward to getting together in person and online to really talk about building this broader movement against the criminal blockade and plan with one another our work in the coming year. So watch the website for details, us-cubanormalization.org. It's been put in the chat a number of times and we'll go ahead and put it there again. Lenny, did you want to talk about the monthly car caravans?
Oh, I did. You know, on the last Sunday of every month, there are car caravans. They're taking places in many cities around the US and Canada. If you can go to the NNOC website or the US-Cuba Normalization website, you can find out if there's already one in your city. And if there isn't, you could start one. Also to the Canadian Network on Cuba website, of course. I am so sorry, Cuban comrades.
Very important international movement. It's been great to be out on the streets with people again in this really creative way, started by Carlos Lasso, a Cuban American with an organization called Puentes de Amor. And so we're uniting on the last day of every month against the blockade. This month it falls on October 31st, which is also Halloween in the United States and Canada. So we'll see what creativity we can add. We've also mentioned before Brigades to Cuba. I'll give a short plug. There's many important travel brigades. The ones coming up most soon are the 31st Pastors for Peace Caravan to Cuba, scheduled for November 13th through 26th. It's not possible to join if you hadn't already signed up, but we need to keep our eyes and ears open to follow their travel and really make sure when they get back that we invite participants to come and speak and share their experiences. To get more information on that, or on hosting a fundraising event in your city, which I'm sure they would always appreciate, Friendshipment Caravan at ifconews.org is the email. Friendshipment Caravan at ifconews.org. Then the 27th Che Guevara Volunteer Work Brigade, which is a project of the Canadian Network on Cuba, is scheduled for November 20th through December 4th, 2021. This is and also there's a 28th Brigade that will go to Cuba around May Day. More information on how to get on the Che Guevara Volunteer Work Brigade, which is not only open to people from Canada, although it's based in Canada, anyone can join. You can contact National Brigade Coordinator Janine Solanki at chevolbrigade@gmail.com, and she'll put her information in the chat if it hasn't been done already. And there's also, as was mentioned before, the Venceremos Brigade, a Code Pink delegation, and the Calixto Garcia Brigade, another important brigade out of Canada, which you can find by searching Calixto Garcia Brigade on Facebook. I think Claudia, who coordinates that brigade, was also here if you want to put information in the chat. The National Network on Cuba and other US-based organizations are also starting to build for the important May Day International Brigade. And so if you're interested in that, and if you want to keep updated, visit the NOC website at nnoc.info. So those are really just a few things. I guess there's one more thing. Yeah, go ahead.
Virtual picket against the US blockade on Cuba, organized by the Canadian Network on Cuba. And the next one will be Wednesday, November 17th. And somebody will have to put it in the chat, but basically you register at tinyurl.com, unblock Cuba. Yeah.
Thank you very much, Dr. Lenny. That brings us, I think, to the end of our program. It's been a longer webinar. We thank you all for your participation and your questions. Very clearly could not get to near all of the questions, but hopefully we gave a powerful overview of why Cuba is leading the way in the struggle against the COVID-19 pandemic. Lenny, I think it'd be great to have if you have some closing remarks, also Dr. Samira Addrey, if there's anything that you would like to share.
I would just like to really thank Dr. Masbenmejo. You can imagine how frustrating and difficult it is when you're at the other end of a blockade and you can't communicate, and I really appreciate his persistence and his kindness.
And Dr. Samira Addrey, any closing words for tonight?
Right on, Lenny, I concur with you totally, and want to thank all the organizers of this event. This was powerful in bringing on the voices of our Cuban comrades, scientists, physicians to educate us on the work that it takes to make true progress in combating this pandemic. And Cuba has shown us a huge way of doing that. Continue to appeal to all participants in this webinar that, we should not belittle the power that we have as individuals and as collectives, and to move in that spirit of collective consciousness that Cuba also embodies, and utilize it in a way to bring down the blockade forcefully, because as oppression continues to double down, we must continue to double down in our defense of what is right, and that is respecting Cuban sovereignty, but also the right to make a better world. So I continue to look forward to whatever amount of events that we have to do. We left so much untouched today. The Cuban internationalism piece, especially the medical aspect, it's such a shame that we didn't get to even go into that deeply, but all respect and honor to those who had been working so hard to get Cuba recognized, the Henry Reeve Brigade recognized for a Nobel Peace Prize. Although we didn't win that Nobel Peace Prize, we did win the People's Prize for the Henry Reeve Brigade, and that's also something amazing. So shout out to all the people who have been voicing that spirit of Cuban internationalism, medical internationalism, specifically. Hopefully we'll have a future webinar on that and tackle all the other questions that our folks have. So you all continue to stay well, continue to protect yourselves and your communities, and continue to have hope, because that is the light for us. Okay.
Thank you so much, Dr. Samira Addrey, 2020 ELAM graduate, now working at Latin American School of Medicine in Cuba, that is, working so hard to recruit more US residents, people live in the US, to study and become doctors in Cuba for free. Also something we didn't talk very much about, but be in touch if you're interested in that program. It's times like these where we really, I think, can imagine and see so clearly what Cuba could accomplish, what they would be able and capable of doing without this criminal and murderous US blockade. Cuba, as we started out, has vaccinated in this last week more people than any other country in the world due to Cuba's innovation and scientific strength, investment in people over profit during this time of blockade, and due to international solidarity that sent millions and millions of syringes to the island because Cuba can't access them due to the blockade. We know what would be possible, and we know where we have to put the pressure, square on the shoulders of the United States government. To confront this cruel US policy, we must build a consistent and organized campaign to be effective. That is the Saving Lives campaign. That is what we are doing here together. We know that the United States government and their allies, like Canada, are very organized and consistent in their attacks on Cuba, and we all have the responsibility to work seriously, consistently, and in unity to expand and grow our local, Canada-wide, US-wide activities to build an effective international movement. I've seen people on this call from across the Caribbean, from Europe, from Africa, and then here in the United States and Canada and Latin America. This is when we invite you to join us in this struggle. Make sure you're watching the websites, your email, get involved, come to a meeting in your community or here on Zoom with people internationally. Viva Cuba!
Que viva!
We'll go ahead and show the trailer for Cuba and Africa. Again, that is going to be an event coming up on November 7th. Very important to continue the discussion about Cuba's internationalism, filmed by Nagash Abdurrahman, and really enjoy this trailer, and we will see you all very soon. Good night.
¿Qué intereses tenemos nosotros allí? Estamos cumpliendo un elemental deber internacionalista cuando ayudamos al pueblo de Angola.
Cuando estábamos en la celda de castigo, la única forma de saber que estábamos vivos era chiflando la Guantanamera.
2.400 cubanos murieron combatiendo en toda África.
Uno empezaba chiflando la Guantanamera. Donde la dejaba, continuaba el otro. Y donde la dejaba el otro, continuaba el otro. La Guantanamera era la única forma de comunicación entre nosotros para saber que estábamos vivos.
Y así venían muchos niños del sur, faltándole piernas, brazos, se han mutilado por la explosión de las bombas y las granadas.
Fue la quiebra de la columna vertebral del régimen del apartheid.
The Cuban people hold a special place in the hearts of the people of Africa.
Y ese día Mandela le dirigió la palabra a la nación cubana. Quiero que sepan que sin la participación de Cuba, yo todavía estuviera en la cárcel.
Yo siempre pensé que regresaría. Estuvimos rato abrazados, mucho rato.
Hemos cumplido nuestro sueño de que África fuera libre de colonialismo y de la apartheid.
Ellos murieron luchando por la dignidad y la libertad de todos los hombres. Para ellos, gloria eterna.
Good night again, everyone. I had a few more thank yous, of course, including my co-host, Dr. Lenny Villagomez-Reeves, but also Erin Feely-Naham has been posting in the chat consistently all the info we need to know. So thank you, Erin, from US-Cuba Normalization Conference Committee and New York, New Jersey, Cuba C for that work. And Aza Rojby, who is with Friends of Cuba Against the US Blockade here in Vancouver, Canada, has also been helping out on the technical side. So thank you, big thank you to Erin, to Aza, to all our presenters and hosts tonight. We'll see you on November 7th for Cuba in Africa. Good night.